Hey everyone, today's topic is post-exercise inflammation. Actually, it's the control of inflammation post-exercise. When we get to that ultimate summit of being 90 years of age with no medicines and very little surgeries or disease, it takes a healthy lifestyle. Healthy lifestyle includes proper nutrition, good sleep, relaxation practice, and movement or activity of some sort. The problem is with my folks who don't have an exercise routine, have no experience to any form of exercise or organized sports. When you initiate exercise, it can actually cause pain. I have a tutorial on delayed onset muscle soreness, and I point out there will be some form of experience of pain. When muscles don't move, in other words, when you stay stiff in a certain position for a long amount of time, the muscle fibers shorten. And all the muscle bundles that comprise muscle fibers that act on a joint will also become shortened. And that might seem that it's okay, but eventually you're going to have to move. Most parts of your body will have to move at some point in time. So if you stay stiff, if you stay immobile, and they ask a region, a joint, an area to go ahead and move, you're going to ask a stiff joint to do some form of mobility, and that can cause pain. At least it'll be interpreted as pain. And that's why it's wise to have some form of activity on a regular basis. The American Heart Association suggests 5 days a week of 30 minutes of activity of any sort. Hopefully something that'll get the cardiovascular system moving. Sometimes you can compress that into 3 days a week, but it'll have to be high intensity. You can't just jump into a high intensity exercise routine if you have no training and previous experience. Thus the reason for coaches. But regardless of whether you have a coach or you're on your own, do expect some form of pain. If you have chronic disease, chronic pain syndrome, fibromyalgia, you might have a flare-up of your syndrome. You might have to throttle your exercise endeavors depending on how the muscle responds and how you tolerate the pain. If you have a system in place where you maximize on your nutrition, always have a rescue as far as prescription medicines, and always have hands-on healing, it would help. Hands-on healing would be physical therapy, massage therapy, chiropractic. Prescription medicines can be in the form of anti-inflammatories, pain pills, or muscle relaxers. Nutrition is what I love to embrace because you don't have too many downsides with nutrition. There's other benefits on the side that you can get when you do an anti-inflammatory nutritional practice. Since most Americans are missing omega-3, I think omega-3 fish oil is important. If you don't like fish oil, there are hints that I have in my previous tutorials on how to tolerate it. But there's also krill oil and flaxseed. Krill, I think, is a little bit too expensive. Flaxseed in some patients doesn't get in. Drizzling it on your salad is probably not enough to maximize on its effects. The suggestion for people with cholesterol is 2,000 milligrams twice to 3 times a day. That's a lot. A 3.5 ounce portion of fish is usually equal to about 1,000 milligrams of omega-3. And you always have to worry about preservatives, hormones, and other heavy metal. Hopefully the distilling process takes care of most of that. Your choices on wild versus farmed will be important. For all that information, I usually suggest reading up on EWG's website, as they're a great organization for figuring out how to protect the public from food industry. I also love the use of turmeric, but the problem is turmeric has to have black pepper to be absorbed. I've done tutorials on turmeric before, and it works great. Glucosamine sulfate is nice for joints. It provides better range of motion and supposedly decreased inflammation to the joint lining. But when you have muscle pain, I think turmeric is a far superior supplement to take. Magnesium, especially if you're deficient on magnesium, and I think a lot of Americans are, is crucial. I think it helps with decreasing blood pressure, helping with sleep, helping with constipation, but it also helps with muscle soreness and palpitations. The problem with magnesium, as I've pointed out in my tutorials, is that sometimes it can irritate the gut, and if you have a kidney problem, you really have to ask your doctor about how to dose it. I would usually get into the habit of doing all that stuff day of the event or day of your training, in addition to the next 24 to 48 hours afterward. That's when the inflammation comes up. Icing and cryotherapy, very important. Heat versus ice, it depends on the patient, depends on the thickness of your skin. I would say try both, but do it on a regular basis, hourly for about 15 minutes. I've seen people come in with first-degree burns and blistering just from ice, so be careful. The other key to inflammation is also staying hydrated. You always have to get rid of that lactic acid buildup. In exercise, especially high-intensity interval training, we develop a tolerance to lactic acid. And when you first experience it, but it'll be achy and full soreness that will prevent you from doing your usual activities in the next 24 to 48 hours. Some people don't like that feeling. So again, if you're going to experiment with this, what I'd suggest is introduction of exercise once a week and journaling how intense you exercised, what you did, then noticing how long it takes to recover. As you progress with your exercise, hopefully the recovery time shortens, but then you have to up the training a little bit to provide some form of stimulation for the next summit. Stretching is very important. That's why I love yoga. And I've had some coaches say that stretching is not necessary. I disagree. Stretching before your exercise endeavor gives you a trep effect where the muscle responds faster, it's warmed up. Stretching afterward is just as important because of the stiffness and the muscle shortening that occurs. Some people will think they're being injured, but you're controlling the amount of trauma to a specific area or region of the body. In bodybuilding, we have targeted exercise routines if you want to build up and change the way certain areas of your body look. The goal, again, is to be tolerant to all forms of activity and then get to an ultimate summit of some sort. As far as how you get there with weight training, high-intensity interval training, CrossFit, machines, biking, running, it doesn't really matter. I just want to get my patients active with some form of sustainable activity. As a side note, what's also important is knowing that when you do exercise, if there isn't enough protein in your bloodstream or in your diet, you'll initiate damage that will trigger your own protein to be broken down for the amino acids. So you have to be careful. That's why we talk about branched chain amino acids or clean protein afterward. I think you can get by with a whole food, mostly plant-based protein source and still have muscle building and muscle growth. But it all depends on your level of taste, your level of cooking, and what's affordable to you. With the problems of cholesterol and heart attack and stroke, I try to stay away from red meat. But the fallacy with a lot of patients is when they think protein, they only think red meat. They don't think fish or beans or chicken. There's a lot of good available clean sources for protein that are out there that you don't have to worry about cholesterol later on. Finally, in the post-exercise phase of 24 to 48 hours, as far as your nutrition, as far as your mobility and stretching, as far as your hydration, you cannot do any further damage. So be careful when you're experimenting with pushing the envelope with exercise. You can expect 24 to 48 hours of delayed onset muscle soreness. So if you do this on a Monday, you can expect that the first part of your week will be really painful. If your job depends on physicality, you might not want to do your exercises on Monday or Sunday. You might want to save it for Friday. That way you have the weekend to recover. And it can potentially lead to a work injury or a dysfunctional movement of the joint that you're working on, which can result in a muscle or cartilage tear. If you have any persistence of pain or if it seems that you flare up your disease process, get in to see somebody to rule out any big diseases. Hopefully this helps. Don't forget to give me a big thumbs up and subscribe for weekly words of wisdom.